Hello, I'm Amy Caples, Assistant Professor of Media Studies and Production at Temple University. Welcome to the second installment of this unique partnership between Temple University's School of Pharmacy and the Institute for Safe Medication Practices, or ISMP. We have a lot of topics surrounding medication error prevention to get to, so let's jump right in. We'll begin this episode with a topic that remains a persistent medication safety problem, one that involves a key component of patient information, the patient's weight. Measuring an accurate patient weight is essential in calculating the appropriate dose of numerous medications. Neonatal and pediatric medication dosages are primarily weight-based. When a patient's weight is not available or is inaccurate, the prescribed dose may be significantly different from the appropriate patient dose, possibly leading to preventable medication error and even significant patient harm. With us to expand on the issues surrounding the significance of accurate patient weights is Alan Veda, pharmacist and Executive Vice President at ISMP. Alan, what are the most common safety issues associated with patient weights?
Well, one of the major issues that we see is actually obtaining an accurate weight on patients. And that may sound as simple, but oftentimes patients may come in through the emergency department, they may be trauma patients, and you can't get a weight on them. But other times, healthcare professionals feel that they're good at estimating a weight. And there's been many studies done over the years that actually show that healthcare professionals are not very good at estimating weights. And patients themselves, if they haven't been weighed in a while, are not good at estimating their weight. Sometimes it could be a vanity issue, that they don't want to state actually how much they weigh, and their caregivers also may not know the weight. So this is one of those important things that we always recommend: get an accurate weight when patients come in to any healthcare setting.
Alan, what steps can organizations take to avoid errors involving patient weight?
Well, one thing is that they need to have a setup to have scales available in order to get the weight. So this is something that, yes, if you go in the physician's office, there's usually scales there. But oftentimes in the emergency department, like when I mentioned about critical patients coming in, there's also bed scales. And not many hospitals may have enough bed scales, or patients may come in a wheelchair. And there's also scales for that. So one of the things we say is to make sure that you have the scales available, and even if you don't have them now, it's something that you could plan for in the capital budget. The other thing too is that you need to have the scales measure in metric weight. And that's an important aspect of this whole issue, is that the United States is one of the few countries in the world that doesn't use the metric system for weight. And unfortunately, or maybe fortunately, all the medications that we use, their doses are in metric. We talk about micrograms or milligrams or grams. We don't talk about ounces of a medication. And the prescriber's information also is available in metric units. So those, the drugs are dosed as milligram per kilogram or gram per kilogram. So everything that we do from a medication standpoint is based on the metric system, yet patients oftentimes are weighed in pounds. And then you have to convert it. And oftentimes those conversions are not done accurately. And it's about a twofold difference. So that if you overestimate or underestimate, you could either be giving twofold more medication or twofold less of the medication. So that's the other aspect, is to not only getting that weight, but also the metric system, using the metric system to actually record and document that weight.
It is hard to believe something as simple as documenting a patient's weight can have such a significant safety impact. Are there other organizations aware of and in favor of using an actual metric weight?
Yes. Aside from ISMP, which we've been advocating this for years, there's also the Emergency Nurses Association. There's the Academy of Emergency Physicians. There's also the Academy of Pediatrics. The Academy of Pediatrics have done a very good job with this, and they actually use the metric weight. They have conversion charts for patients so that everyone likes to know, especially with their child, how much, and the metric doesn't make a lot of sense to them, but they have conversion charts for the parents. But they're doing an excellent job with this.
Thank you, Alan Veda, for that update.